as part of the 8 petals of Asian medicine, taking care of yourself, we started with meditation, just to, as a reminder, we started with meditation and then Qigong, and then the diet and nutrition, and then this massage, tuina, shiatsu, and this acupressure can be seen as a type of massage, and it has the same history as acupuncture. It's over 4,000, probably over 5,000 years that these points have been in existence and have been used as a way to cultivate the balance in body, mind, and spirit. So the points that we've listed here are selected points out of hundreds of points to take care of certain maladies, and you can see their use, and the more you become familiar with them, the more you can use them for yourself and others, family and others, to help balance the energy of the body. So by massaging these points, activating and stimulating the qi, the vital life force, it's qi, the Chinese is qi, often you'll see it chi or qi, but it's pronounced qi. The Japanese is ki, ki, and it is the same as the Sanskrit prana, the wind and the energy, the vital life force that courses through our body in the meridians. And these points are found on the meridian channels, and we can influence the vital life force by activating these points on the channels. So from the place where we left off, I think we did 10 points last time, and that puts us, did we do Spleen 9? I don't think so. Can we put the chart on the screen? Is Joe with us?
Mentally, no, but I can do that.
Okay, thank you, Joe.
All right, let me just find out where I am in life. What point?
Yes, let's put point number 11, Spleen 9. That's it. I think that's where we left off. I don't think we did Spleen 9. Maybe we'll do it. We'll just review it. This is very close to the 9th point that we did, liver 8. Let's back up to the couple of points. So crooked spring, liver 8, and let's go to liver, to the point 11.
Wait a minute.
There's liver 8, and there's liver and spleen 9. So the liver 8 is a little more central to the center of the popliteal crease. The spleen 9, as it says, if you're reading the location, it's in the depression below the inferior border of the medial epicondyle. The epicondyle is the large protuberance that you see right above spleen 9. And this is medial, so it's on the inside of the leg. And as you walk your finger up the femur, the large bone of the lower leg, you will just dive in again into a place just where the head of the medial epicondyle begins to come out. And it's probably tender to touch with pressure. So in the depression, below the inferior, that's the lower part towards the toes, the inferior border of the medial epicondyle, that's the protuberance there, posterior to the edge of the tibia. Is everyone clear with that anatomical location? Palpate there on both sides. It is often tender, which means it's a good point to massage. So this this particular point functions, regulates and tonifies the spleen, stomach, and lower burner. So when we say lower burner, we have an upper burner, which has to do, with the heart, lungs, pericardium. Middle burner has to do with digestive system, liver, spleen, stomach. And the lower burner is the kidney, bladder, urogenital organs. So it reduces dampness and promotes urination, clears heat, treats abdominal distension and diarrhea, dysentery, all kinds of abdominal problems, edema, which is swelling, urinary pain and incontinence, enuresis, menstrual irregularities, genital pain, and knee pain. It's a very commonly used point. And anytime you're palpating these points and they're tender, they often require a little attention. So you don't have to, it's not necessarily no pain, no gain. It should hurt good when you're palpating the point. Not too much, not too little. You're going to feel the sensation, but, people say, oh, it hurts good when you apply pressure. The mental, emotional, and spiritual aspects of this point, it resolves feelings of dependency and the inability to receive or give nourishment, support, and compassion. The inability to do that. Used to help ground and stabilize and center oneself. This has to do with the earth element, earth. And earth has to do with our mothering, our ability to support one another. And just as a mother nourishes the child, it gives us the capacity to have compassion and nourish both ourselves, but others too. Some people have very little capacity for that, and this point is good to help us have compassion. It's used to help ground. It is an earth point, so earth is about grounding, being stable, being unshakable like a mountain, stabilizing and centering. Relieves worry, mood swings, codependency, boundary issues, and reduces obsessive compulsive tendencies. Obsessive compulsive situations are really excessive worry, and there's a variety of neuroses that go with each of these elements. Being obsessive and compulsive are aspects of the earth element. So it helps to neutralize those tendencies mentally and emotionally. Has everyone found Spleen 9?
Yes.
Okay, good. Do it bilaterally. Feel that point in the depression below the inferior border of the medial epicondyle, posterior to the edge of the tibia. Posterior means to the in back of. So you find the tibia and its.
Lama, I'm finding that the tapping the points is very effective too.
Yeah, it is. You can just put your finger on there and imagine from your dantian, or from that point, 3 finger was below the navel, what we talk about as the dantian in martial arts, imagining energy coming up and down your arm and into the finger. So, and just putting the finger on the point and imagining, a laser light energy, heat going into that point. Tapping is fine, massaging is fine, but yes, tapping is definitely a way to do it. More is not necessarily better. The mind, energy goes where the mind goes. So just thinking about that point, its location, and imagining energy being there, it will go. But just for the sake of enhancing your connection with the point, touching it, massaging it, just brings more emphasis and more intention. We really want to have an intention with the point. So imagining where it is, just like when we do our visualizations, visualizing the point and having intention to stimulate the point is as important as the stimulation itself. So, there is Qigong healing where you can put your hand not even on a point and direct energy to it, and you will get pulse change. That is necessary. And as you work with these points more and more, your hands, your fingers will sensitize yourself to the point, and you'll feel the qi at the point. We use the pulses as a diagnostic indicator, and we take pulses before the treatment and we take pulses after the treatment to see if we've actually made the correction necessary. If the pulse is full, it should become soft, or if it's excessive, it should become soft. If it's deficient, it should become have more qi, more vitality, more luster. It's sometimes said. The point has more luster. So you can familiarize yourself with these points, and cultivate a particular awareness, a sensitivity in your fingers for locating the points, and a facility for stimulating points as well. So the next point is bladder 54, equilibrium middle. It is in the center of the popliteal crease. So it's that line in back of the kneecap where the leg flexes. It's right in the center of the popliteal crease. This point will strengthen the lower back and benefits the hips, strengthens the knees, and relaxes the sinews. So again, sinews are the connective tissue, ligaments, tendons. Muscles, when they come to their point of insertion, become tendon. So the muscles attach to the bones through the tendons. The ligaments attach bone to bone. They're stronger, thicker, and bind bone to bone. So when we talk about the sinews, we're talking about the muscles, we're talking about the ligaments, tendons, connective tissue. So it relaxes the sinews, alleviates pain, treats lumbar pain, impairment of the hip joint. This meridian runs through the hip as well as it travels along the meridian. Treats lumbar pain, impairment of the hip joint, sciatica, knee joint, and surrounding soft tissue, urinary incontinence, dysuria, premature balding, arthritis, swollen feet, stiff neck, and hemorrhoids. The mental, emotional, and spiritual aspects, as listed here, enhances memory, mental clarity, emotional stability and calm, quiets the mind, reduces nervousness, and promotes meditation. The water element is the extreme yin element. So when it's working properly, it's the yin energy of quiet, meditative energy. Usually, our fire element predominates, and we're just overly aggressive and jumping from thing to thing. The water element has to balance the fire element. If it is not doing its job, then the fire blazes out of control, and you have a lot of symptoms. Often cardiac symptoms are not fire. The heart is associated with fire element. Are not fire element problems. They're actually water element, kidney and bladder, which are insufficient to control the fire, and it rages out of control. So in this way, the water element, the bladder and kidney, helps to quiet the mind, and the brain is seen as a sea of bone marrow, and it is connected with the kidneys and bladder as well. And that's why it says enhances memory and the mental clarity. Quiets the mind and reduces nervousness and promotes meditation. That is true pretty much with all of the water element points that we've done. The kidney 3 is a particularly good point as well. Kidney 10, which we did last week, Yin Valley. But I think what maybe we'll just add a couple more, the 13 and 14, because they are side by side with each other. And Heavenly Pillar is a particular interesting point, as is Wind Pond. So these are on the base of the occiput, the base of the skull, on the back of the head. Bladder 10, Heavenly Pillar, is on the posterior surface of the neck, 1 anatomical Chinese inch, lateral to the midline, in the depression on the lateral border of the trapezius muscle, below the base of the occiput. So you'll feel the attachment of the trapezius muscle, that is the large muscle in the back. The traps are the ones who help you raise your shoulder and like that, but they attach at the base of the occiput. And you will find a depression. 1 anatomical Chinese inch is the width of your thumb. So from the midline, coming out about the width of your thumb, right on the base of the occiput. So you'll feel the bone and just drop down a little bit below the ridge of the bone and press in and up. And you'll find the point Heavenly Pillar in the depression on the lateral border of the trapezius muscle below the base of the occiput. I say these points are close together because we'll be doing a gallbladder 20 Wind Pond, and that is just another half of ACI lateral to bladder 10 from 13. So it's just next to it on the base of the occiput as well. Those points may also be tender, and that's kind of a natural place that you may massage if you've got a headache or a stiff neck or tension from being at the computer, and our heads are down and we're concentrating so much. There's a lot of tension in the upper back and neck. These points are very good to help release that tension. So the function of Bladder 10 opens the sensory orifices, eyes, ears, nose, clears heat, strengthens the muscles and tendons. This is known as a window of the sky point. There are several windows of the sky, and as it sounds, they can open your mind to a higher realization. These points are not used initially in treatment as a window of the sky. They usually, the body, when it is in a state of balance, when you use this point, it can really, it's like opening the window to get a breath of fresh air, a new perspective, and insight in seeing things differently. Sometimes the window gets cloudy or dirty, and or there's no circulation. So opening this window of the sky allows this new insight or energy to pervade. It treats occipital headache and pain, stiff neck, nasal congestion, shoulder and back pain, blurry vision, whiplash, traumatic neck injuries, dim vision, inability to smell. That's bladder 10, heavenly pillar. Anything that has, the name heavenly in it is associated with the spirit. So this is a window of the sky, which is associated with the level of spirit in our body, mind, spirit. So mental, emotionally, a window of the sky has strong spiritual implications, as it said. Support or a pillar for those who may be overwhelmed and afraid to see, to hear, to feel what is needed to move on in life. Enables one to cope by strengthening resolve and spiritual insight. So again, I think we should, before we close out these points, we should talk about bladder 10, the heavenly pillar. It has such a beautiful quality to it. Any question about that point? Everyone feel like they found it?
So Lama, for this, it's also bilateral.
It is bilateral, yes.
Okay, thank you.
That picture or diagram is not the best, but it shows 2 points on either side of the spine. It is all these points that we've talked about so far are bilateral. There are some points on the sternum and on the spine that are not bilateral, but we haven't done any of those yet. So point 14 is a gallbladder 20. This is on the gallbladder channel. GB stands for gallbladder. It's translated as wind pond. It's on the posterior surface of the neck, 1.5 ACI from the median line at the base of the occiput. So from the center of the occiput, coming over just a half an inch or so from bladder 10, you'll find gallbladder 20. So it functions to dispel the exterior conditions such as wind, cold, and heat. Often, wind penetrates through the pores. And, your mother may have told you, don't go outside with wet hair in a wind because it is cold. It will chill you. It will chill the sinews and the back of the neck and lead to a variety of problems. Wind-cold invasion is what we call cold and flus. when cold. That's why I also mentioned not sleeping under a fan. You may be covered, but your head is not. And over the period of a night, that wind will penetrate through the pores of the skin. And if you're on your back, then the sinuses, the eyes, nasal cavities will be affected from the constant wind invasion through the pores. And as we sleep at night, the Wei Qi or protective Qi that we have on the surface of our body goes deep into the organs to heal them and protect them and nourish them. So we don't have the same protection from the wind as we might have during the day. And people who have good immune systems have good Wei Qi, that's W-E-I, Wei Qi or protective Qi in Chinese medicine. And that protects one. Some people get the colds that go around and some people don't. Those that don't have a good Wei Qi, those that get them often are deficient. Their Wei Qi is not, it's a protective layer that protects them from viruses and when cold and a variety of other things that invade the body. So it relaxes the sinews, facilitates the flow of qi, brightens the eyes and opens the orifices, treats the common cold, headache, dizziness, stiff neck, nasal problems, eye disease, tinnitus. And again, tinnitus is ringing in the ears. Sometimes people pronounce it tinnitus, but ringing in the ears. On the mental, emotional, spiritual level, it supports emotional openness. On the mental level, it helps with issues requiring clarity to see the whole picture. It opens the senses to augment perception at all levels. So protecting your neck in the wind, when it's cold wind, wearing a shawl or some protection around your neck is a good idea. Scarves are more than just an accessory. They actually serve a function. Any question about those 2 points? Or the 4 points that we just did? Spleen 9, bladder 54, bladder 10, gallbladder 20. Points number 11, 12, 13, and 14.
Lama, are those 13 and 14 good for vertigo?
They can be used for vertigo, but there can be different reasons for vertigo. But yes, you could definitely think about those points for vertigo.
So, in treating neck pain with ice, I would wonder if you would support that treatment.
In treating neck pain, yes, I would definitely use that for neck pain, those points.
No, what I mean is, if you're recommending that we not get chilled,
Yeah.
what about the use of ice as a treatment to pain?
It is okay in the first 24 hours, of an acute sprain or strain. But in general, I use heat more. But if you sprain your ankle, you want to reduce the swelling, so you use the cold, you ice it. That is still true. But after 24 hours, certainly after 48 hours, then you want to, you can use contrast as well, cold and heat. So the cold is contracting and the heat is expanding. So you're moving the fluid by contracting and expanding the vessels. But after a 24-hour or after the acute episode, then we move to heat. So we get more blood flow, more oxygen, more nutrients to the site for healing to take place. Cold literally, freezes the area. It stops the blood flow. But in the beginning, to reduce the inflammation, that's good. But remember that inflammation is the body's mechanism for healing. That is the body's natural way of getting more blood, more oxygen, more nutrients to the site. But it can also be excessive. So we want to stop further swelling by using it as in the first 24 hours. But in general, heat works better, but contrast can also be used. Cold, then hot, cold, then hot, like that. Does that answer your question?
Yes, thank you.
I mean, you can freeze those, if you're in pain, cold is going to freeze those nerves and it's going to reduce the discomfort. That is for sure. And that's in the beginning, fine. But if for bruising and things like that, for example, that will create more stagnation of blood, the cold. And we don't want to have a bruise stay stagnant and cold. We want to improve the heat, improve the circulation, move the blood so the body reabsorbs that bruise or the blood that's pooling in a certain area. Make sense?
Yes.
Okay. All right, any other questions about the points in general? These are ways that we keep the chi moving. We started with meditation. With any trauma, it's best that we tame our mind. It's doing qigong is also a way to move the qi in the blood. Our diet is also important for our health and well-being. But here we are creating the circumstances of going directly to the channels and moving the qi in the blood through manipulation, through acupressure or massage. So we can massage along the channel, we can massage the points themselves, you can tap either with your fingers or, in a larger space with a gentle fist in certain areas. Sometimes you'll see tapping, all along the meridians. You can tap all along the meridian. So you're stimulating the qi along the channel. So we don't have a picture of each of the channels associated with these meridians, but they are easy enough to find. These the 12 channels associated with each of the organs, and stimulating them with the points or with qigong by moving the qi, or with tapping along the meridian. Those are also ways that are in this domain. When we look at this particular process of the Eight-Petalled Lotus, massage, tuina, acupressure, shiatsu. There's lots of different methods for moving the qi in the blood. But that is the fourth of the 8 branches that we're going to be talking about. The next one is going to be the I Ching, or Mo, divinations, and based on Bagua, or the 8 kind of movements. And then Feng Shui. Feng Shui is really having to do with, it's like acupuncture for your environment. It's all about the qi. It's all about the movement of qi, whether it's in your body or outside in nature. We are part of nature, the macrocosm and the microcosm. So how we direct that qi, if it is stagnant in one's living space, it's going to create problems, just like if it's stagnant in your body. And they both have a result. So we'll be talking about those things. And then somewhat herbal medicine, and also the theory of acupuncture. This is the same as acupuncture, except you're using your finger or massaging instead of using an acupuncture needle. This was done earlier by having a shard of stone they would use to stimulate the point. You can also use heat, Moxibustion to stimulate the point. You may have seen cupping to stimulate along the channel. That's the use of like a suction. Often you'll see alcohol put in a little cup, glass cup or bamboo cup, and then ignited and put over an acupoint or an area, a larger area, to stimulate the blood flow and the movement of qi. Who was the swimmer that in the Olympics last time that he had the big marks on his back from having cupping? For athletes who overexert, overtrain, or are really pushing hard, there's micro bleeding in the tissues, and the cups are placed to pull that to the surface, and they can be bled, and you get that out so it's not stagnant, and it's replaced with fresh blood that enhances the muscles and connective tissue again, and improves performance. That's cupping. And I don't know if you've heard of Moxibustion, the application of either indirect heat over a point, like with a Moxa stick. It looks like a little cigar. It's Artemisia, which is a mugwort, basically. It's made into, it's pressed and made into like, it looks like a little cigar. And you can do indirect heat over the point, which is very helpful in some situations. And bleeding is also done. If you have little petechia or places of blood stagnation, you can do bleeding to, that is also stagnant blood and it's not moving. And you can remedy a lot of situations with that. And the cupping. Are you familiar with those things? Have you had any experience with?
Yes, all of them.
All of them, yes. And yes.
I have a question. The for me, when you describe this seems like when you're talking about the bleeding or getting the petechia out and everything, that seems to be reasonable and has a cause. So what happened when that whole theory of bleeding came over to the Western world and they literally exsanguinated people in the service of curing them? Is that just a Western over-calculation, or?
Yeah, they just did too much bloodletting. I mean, pints of blood. This is, this is just a little bit to remove the stagnation, get the qi and blood moving again. So it is a matter of degree. And for someone who is blood deficient, you don't want to do that. So blood is a very important substance. It's more than just water. It contains our immune system. It's precious. And blood deficiency is a problem for people. And so some people, you have to promote the quality and quantity of blood. But in some situations, when it's excessive, actually bleeding is a very important therapy. But yes, it's a matter of degree, and it's a matter of, that was just not the proper use of the technique. We're talking generally just a couple of drops of blood. It doesn't have to be a quart. And some of you may have had the experience of having for example, a sore throat. I will sometimes do a point on the thumb, lung 11, and prick it and bleed a couple of drops. A person may have a sore throat, and it'll take that sore throat away in a matter of moments. So it's just, and we're talking about a lung point that is on the thumb, and we're talking about someone who is experiencing excruciating pain in their throat, and moving that qi, which the lung does affect the throat, obviously, you can really fix that problem swiftly. There's a number of things that you use these points very specifically, and every point does what no other point can do. They each have their own personality, and they're named somewhat accordingly. But each of the points, as you become familiar with them, has a very particular usage and has its own personality. And there are hundreds of points. Any final questions as we wrap this portion up? I mean, we can go on with more points if you choose, but I'm wondering how this is for you. If you're feeling like you're overwhelmed already with this, or if you'd like to continue, let me know what your feeling is about it.
Lama, I have a question. It's I think it's a no-brainer, but my lovely wife wanted to know if you can do acupuncture too much, because she sees me doing these points a lot.
The acupressure, no, the body is very forgiving with that, and it'll take what it needs. Can you do too much? Yes, you could, but if you're just doing it for a little bit of time every day, no, there's no problem with that.
Thank you. And I would vote for more acupressure. Just letting you know.
Okay. Do I have here a dissenting vote? Would you like to get on with this, or is this helpful to you in some way?
Lama, I am ready for the Yi Jing and Feng Shui.
Okay. So that is all right.
I was thinking also that if we progress and then come back at the end, maybe for first aid points for acupressure, like you were talking about, the sore throat, or however you would approach that.
Yeah, we can do the special points for first aid. Yeah.
Lama, I have a question about, I have seen people wearing like a little band around the knee area. Is that a pressure? Is that using acupressure? Do you know? For knee pain, it's for knee pain, is what I've been told.
Yeah. Yes, you can use that. What you often see is a point around the wrist, pericardium 6, which is about 2 anatomical inches from the wrist crease, which we are going to do. Well, if we come back to this, we will do it. It is for nausea, and it is standard issue.
Yeah.
The CBs, the British Navy. It is the point for nausea, and whether it's nausea from pregnancy or motion sickness or any kind of nausea, and you can get those in Walgreens, and it is a little band that has a little point on it, and you place it over that point, pericardium 6, and it has the effect of reducing or eliminating nausea. So yeah, these points can be used, and you'll see, like you say, bands for that. The most common one is for nausea.